Hey, my name is Emily Corley. I'm a student physical therapist assistant at Jeff State. Today I'm going to be talking about interventions for burns for PTA 251 therapeutic procedures. So before I talk about the interventions, I'm just going to talk about how first how they happen, the different degrees of them, and some medical treatments that can be done also. So to begin with, burns, they can happen in several different ways. Flames, an open flame coming in contact with that, a scalding liquid or steam. A thick liquid would cause a deeper burn. Electrical, so being struck by lightning or touching an active wire can cause a current of electricity and will cause an electrical burn, and these are usually pretty deep and pretty severe. You also have a chemical burn from chemical gases. They can be inhaled and even burn the airway. Contact burn, touching a hot pan or hot curling iron would be considered a contact burn. And then you have radiation, which would be from UV rays, sunburn, or the tanning bed. So the first burn classification is superficial thickness. It's a first-degree burn, and it's only to the epidermal layer. It'll be painful and sensitive and dry and definitely red. And then you have your superficial partial thickness burn. So this is considered a second-degree burn. There are two different thicknesses for second-degree burn. This one is through the epidermis and into the upper portion of the dermis, which is the papillary layer. Blisters will be present, and it's also still very painful. And then you have your deep partial thickness burn, complete damage to the epidermis and papillary layer, and it also extends into the lower portion of the dermis, which is the reticular layer. And finally, you have your full thickness third-degree burn, all the way through the epidermal and dermal layers, and some of the subcutaneous fat layer may also have damage. You also have a subcutaneous burn, which is all the way through the fat layer down to the bone as well. But this one is typically not painful just because the nerve endings are destroyed. So medical treatment, depending on the severity of the burn, they could have a skin graft that's usually seen in third-degree burns. They take healthy skin tissue from somewhere else in the body, and they will place it onto the burn section of the individual's area that's burned. Okay, and so for less severe burns, they will be maybe prescribed or over the counter, just topical cream to help some of the pain and burning and to get the redness down. They also might get pain medication because you can have a lot of pain from burns. And depending on if the PT is comfortable with it, they could do debridement of it with sharps, or this could be done by the medical doctor as well. So some therapeutic objectives, the first and foremost, the patient with severe burns need to be positioned in a way that will not cause contractures. It's usually not a position of comfort. So, and also the therapist should, they should consult with the burn team to make sure that there are any other issues that need to be talked about, concerned about. Okay, so like I said, positioning. They are, depending on where the burn is, the patient should be, it should be an elbow extension, shoulder abduction, leg abduction, and knee extension. You can see by the picture here, this is where a patient with severe burns would be placed. And this is very important to do immediately. Okay, and now edema control. This is also important to get some of the swelling down. It can be done in several ways. Positioning, obviously, is very important to elevate the extremities. Keeping the hands and ankles moved. This will also help prevent maybe a DVT that could happen. So also, like I said before, preventing edema and positioning is very crucial to prevent contractures, which if you have contractures, it'll cause more scarring and just will not be able to heal the patient in a way that he'll be functional or she'll be functional in the future. Okay, so range of motion exercises. This is also just to help prevent contractures and to keep the joints Moving, it definitely depends on the severity of the burn. So the PT or PTA needs to be in contact with the doctor and the burn team to make sure that they're on the right track. But definitely keeping different areas of the body moving. And this can also be very helpful during dressing changes so that the therapist can actually look at the wound during the exercise and be able to make note of what it looks like. Okay, and also scar treatment. This is very important to do scar mobilization. It will help prevent contractures, which is a huge thing. You could do prolonged stress or compression garments can help with this overall scar formation. So depending on the level of the burn, the patient will be prescribed the correct garment. And you can see a few down here below. And these are just some devices that can be used. This one down here with the arm, that's keeping them in a safe position, also providing some compression. And the foot one, it's elevating the heel off of like keeping it non-weight bearing, which will help also with keeping it elevated and just keeping it compressed, so that'll help with scar and healing. Okay, so deep friction massage. To help break up some of that scar tissue and adhesions in the underlying tissue will be very crucial. And this also depends on the healing process of the patient. You don't want to start this too quickly because the patient will be in severe pain, but it is important to do that. Okay, and you can see my reference here was from the book. Thank you for listening to this today.